All right, so amyotrophic lateral sclerosis is often called ALS, and it's also often called Lou Gehrig's disease. And Lou Gehrig, if you don't know, was a famous baseball player, a first baseman, who had this condition, and so it was kind of named after him. Some other famous folks who had this condition, you probably know the physicist Stephen Hawking, and then a person that you probably don't know yet, but who was influential in the massage community is Nina Mcintosh. And she wrote a book that we used for our ethics class for many years called Educated Heart. And we have some copies in the classroom, and it kind of reads more like a kind of a book, not a textbook. And it is a useful book, I think, for ethics. So ALS, as I mentioned a second ago before we started recording, is, it's not that common. To give you kind of a sense, in the United States, about 15 to 20,000 people have it. And I'm not saying numbers expecting you to memorize numbers, but to kind of give you a sense kind of how common this is. What ALS is nerve damage that leads to muscle atrophy. That's its primary characteristic. And the way this is described is a progressive degenerative disease, and that would be to the nervous tissue that leads to atrophy of the muscles. So people can, feel, but they lose their, in the muscles, they lose the strength. In other words, they shrink or atrophy. And the name amyotrophic is referring to that muscle atrophy, and the lateral sclerosis part of the name refers to the hardening. The sclerosis is the hardening part, and then the lateral is the part in the spinal cord that's actually hardening. Interestingly enough, for some unknown reason, military veterans have more than the general population. I already mentioned kind of the overall demographics of about how many folks get this. And again, we're not going to talk about every single little detail here. So if I kind of paint some general pictures here, the causes are basically unknown. There's some suspected genetic mutation with environmental factors. The exact causes are unknown, but what ends up happening is that the astrocytes, and I think we have a picture of this, so we'll go to the picture, but basically the astrocytes degenerate, and in that process we have the muscle atrophy as a result. Another factor that seems to be playing a factor is too much glutamate, which is an excitatory neurotransmitter. And the reason I bring that one up is that one of the medical treatments is to kind of decrease the glutamate levels, which can, delay the degeneration. That degeneration, though, is, really very, very progressive. Usually folks have this between 2 and 10 years, and then it's fatal. And the average is actually 3 years. So within, diagnosis, folks usually die from this within 2 to 10 years. Median is about 3 years. There's these different. Yes.
Sorry. Do you know what it is that makes the glutamate more prevalent in the system?
I do not. Mm-mm.
Okay, no. Thank you.
I'm not sure if it's known. I did not see that in the textbook. That would take further research.
Thank you.
Sure. So there's different types of ALS. And again, sometimes in the conditions, if we get into all the different types, it's a little too detailed. But I'll just kind of bring up the most sort of common facts here, is that this sporadic ALS is the most common, to the degree of that being about 90 to 95% of diagnoses, right? So that's a really big percentage, and that's in the United States. Let's look at the different types with the variations, signs, and symptoms. So in about 75% or 3/4 of cases, the spinal cord is affected first. So, this could be affecting more of the upper body first or more of the lower body first. So early onset signs and symptoms for this could be things like, if it was in the upper body, somebody would lose or could lose fine motor control with their hands, with things like buttoning a shirt or writing, like those kind of things might go first. Usually the dominant hand is worse, but it can be bilateral. And if it was a lower body, it could be like tripping and stumbling, things kind of coming up early. Also, cramping and spasming is common with this, so that could come on, kind of earlier or later, as well as fatigue. But of course, with neurological conditions, right, there could be a lot of different causes for losing fine motor control and tripping and stumbling. So of course, this is not the sort of thing that, it's not a good idea to self-diagnose. It's very important to get this checked out, right? I mean, different things like multiple sclerosis can end up with sort of similar symptoms. And of course, that's not the only thing that could have that type of symptom. And then eventually this could actually get all the way to affecting breathing. And both kinds can also affect, like once it gets to breathing, also can affect like swallowing. And so one of the things that can be fatal is actually with this getting pneumonia. And so some of the treatment is addressing that, including preventatively, like helping have less saliva, to not be kind of choking on saliva. So, and that's actually a good transition to the part that affects the cranial nerves first. And with that, you can have the swallowing problems or even a gag reflex. And this one has a faster progression. So our signs and symptoms, I kind of talked about early onset signs and symptoms, just keeping in mind that sort of classic signs and symptoms are spasticity, or in other words, spasms and cramps, while also having muscular weakness. That can also have exaggerated reflexes with it. This can also be painful. Like I said, the sensory neurons are intact. So, people have sort of typically have regular feeling and sensations and cognition, but impaired motor abilities. So taking a look at the treatments, the various medications that are used to address typically the fatigue, the spasms, infections, as I mentioned, the level of glutamate, also psychotherapy and medications for anxiety, depression, etc. Other treatments include PT, OT. The heat could be also like in a whirlpool, speech therapy. And then assistive devices can vary, right? If the person is that might be like arm braces, leg braces. It can get to the point of battery operated wheelchairs. It can be speech assisted devices, whether that's for like a computer. And I mentioned the anxiety and depression already. Massage, these are the medication types that I mentioned what they're for. And then massage can help with the spasm, the stress, the mood. We can't help, with the atrophy of the muscles. Be aware that the person might have, strong spasms. Be aware that there might be cramping. And then depending on the progression, right, the person might be on different assisted devices, very different functionality or limitations in their movement, even in, their speech, and being aware of secondary infections, right, and suppressed immunity, especially as this goes on. So remember that the person, even though they're becoming less and less mobile, that they usually have all their cognition intact, and communication and feedback is critical. And this last bit about with pain reduction and breathing, I mentioned that this can even get to issue even with pneumonia, but massage can help working with keeping the breathing muscles intact as long as possible. Now, I said this is not a super common condition, and I have not worked with clients with ALS. So I think it'd be great to take a little time to look at, there's a really great case study in the module. So I'm going to pause the recording and give directions for like a 5-minute, 10-minute activity with the case study in the chapter.